I also want to thank Jim at the Claymont Community Center and the staff of the Claymont Family Health Services for hosting us today. Thank you very much. Claymont is one of 20 organizations that make up the public and private coalition known as Healthy Delawareans today and tomorrow. Since the coalition first convened in April of 2007, this effort has linked nearly 26,000 uninsured Delawareans to free and low-cost healthcare services, including medication assistance programs and transportation. In addition, the coalition has made more than 66,000 referrals for services such as health screenings, mental health counseling, and diabetes treatment. AstraZeneca, with our partners, is proud to support a number of programs that expand healthcare services. Let me share just a few of those with you. First is Christianity in each of the 4 federally qualified healthcare centers that hired patient navigators to work with patients during the intake process to help connect the patient to the healthcare services that they need. The second is Generation Home Healthcare, provided a new service, and I think this is a really important one, free transportation for the uninsured that helps them get to and from medical appointments. The Delaware Foundation for Medical Services expanded the volunteer initiative program by almost 100 doctors. Today, more than 500 primary care doctors provide health care for eligible uninsured Delawareans, referred to them by the Community Health Care Access Program. And lastly, within AstraZeneca, we expanded our patient assistance program to cover those who are working with no insurance. But just recently, we added to that to cover patients who recently lost their jobs. Last year, we helped more than 500 Delaware patients fill over 4,500 prescriptions. By working together with our health partners, real progress can be made. None of us here today pretend to have all the answers, but all of us remain committed to being part of the solution. On behalf of everyone at AstraZeneca, I want to thank all the partners that have helped make Healthy Delawareans today and tomorrow such a big success.
This really is where Delaware shows off at our best. When we come together, when organizations like United Way and organizations like Christianity Care, and it is great to see Dr. Newman here with us as well as Dr. Reagan, companies like AstraZeneca, the state of Delaware, organizations like the Claymont Community Center, and many other organizations represented out here today. You know, we just went through this big debate as a country for the last year on health care reform. And no doubt there will be significant implications for that for all the people in Delaware, the companies here, for the health care system. But what I so much appreciate about this Healthy Delawareans coalition is the fact that everybody who's involved in it didn't wait. Nobody here was waiting to see what they did in Washington. Nobody was waiting to see whether Dover passed a new law. People here said, we've got people who have needs, and we're going to make sure that these needs are addressed one way or the other. And you come together and you figure it out. And you've done so across government, private sector, community groups, medical professionals, and others. And that's really why I'm here. And I think it's that when Delaware is at its best, when people take responsibility, and we say, how can we work with government, but we're not going to always rely on government to get everything done. And my guess is I'll probably speak to Congressman Castle, although I would never deign to do so. My guess is, yeah, he probably looks at it the same way. This is not a partisan issue. This is not a level of government issue. This is about Delawareans getting together to work cooperatively on behalf of the people of our state. And that's really what it's all about. And for that, I'm very grateful. I have here a statement that I'm not going to sign. Always drives me crazy. Elected officials read these really long documents. I'm not going to do that. But it's a statement in observance of Healthy Delawareans today and tomorrow month. And it's signed at the bottom by Matt Den, who is our Lieutenant Governor, and me. And in fact, we declare April 2010 Healthy Delawareans today and tomorrow month. But the point is, the real question is, what happens after a day like this? Because this is a piece of paper. And a piece of paper can either end up on a wall or end up on a shelf, and we can break out a very similar piece of paper next year. When we do the same thing, we can all gather again for another group of speeches, another celebration of healthy Delawareans things for a month. Or we can all dedicate ourselves that we're going to say, okay, there really is a lot of energy in this room from all kinds of people, and every one of us is going to go out and really work to make sure that we're all providing services and volunteerism and everything else that's needed to make sure that everybody in Delaware who needs access knows how to get it and the fact that we're providing it. And that's what it's all about. I'm going to leave and do everything I can to work on this issue, and it gives me great comfort to know that all of you will as well. So,
we decided to put a stake in the ground and focus our strategy around 3 key areas. The importance that we believe are the foundation for a better life for all Delawareans. And that's the importance of education, income, and health. We believe that everything starts with education, particularly those early years for our youth, to ensure that they start school ready to succeed. And working collectively with other community stakeholders to ensure that all of our students graduate from high school and transition successfully into a post-secondary school and or into our workforce. Income is critical for all of us. We want people in our community to have a pathway out of poverty. We want them to live beyond hand to mouth. We love for them to be able to have savings and home ownership, to put away for their kids' college education and retirement. And we believe that health is critical. We believe that all Delawareans should have access to quality health care services. The people with disabilities in our community and our seniors should have support services to maintain a good quality of life. And that all services, when we define health, including mental health, mental, dental, and just medical services are critical. And so that was 2006. At the beginning of 2007, we were fortunate to have conversations with our partner, AstraZeneca, who had a like mind around the health agenda. And we collectively came up with the idea to form Healthy Delawareans Today and Tomorrow. That we recognized, I think, as Representative Catholic said, that these issues are too big for any one organization. They're too big for the state. They're too big for United Way. They're too big for AstraZeneca. It really takes a collective community to come together. And so I can't tell you how excited I was that in 2007, when we formed this coalition together of like-minded agencies, the executives and leadership that made them up, that we came together and put a stake in the ground around how do we ensure that the 100,000 plus individuals in this state, approximately 1 out of 9 individuals without health care coverage, have access to health care. We want to keep continuing to increase the awareness of the great services that exist in our community. We want to find opportunities to learn from best practices across the state of what's working. We want to keep identifying where the gaps are and what we can do collectively to fill them. And if I were to be able to close this part of my speech until I give you just the final closing instructions, I would say the headline for today is, "The best is yet to come."